Welcome to Know This Live. I'm Zinhle Essamuah. Today, we're going to be discussing the state of the pandemic, messaging on masks, and much more with Dr. Leana Wen. She's an emergency room physician and public health professor at the George Washington University. Previously, she served as Baltimore's health commissioner. She's a contributing columnist for the Washington Post and the author of a forthcoming book, Lifelines, A Doctor's Journey in the Fight for Public Health. Thank you so much for being here with us.
Great to join you. Thank you for having me.
Of course. And following President Biden's address to Congress, I want to just jump in. You wrote an op ed that said he sent the wrong message about vaccines. What did you see wrong with it, and what should the message be?
Look, I know that we look to our presidents as role models when it comes to good public health behavior. And when there is caution that's needed, we need the president to project caution. When there's hope and optimism, that's what we would expect as well. The previous president, President Trump, did exactly the opposite. He held these maskless rallies in the middle of the worst of the pandemic. There were super spreader events at the White House. And I definitely understand that President Biden may want to overcorrect here and really project an abundance of caution. The issue, though, is that overcorrection also comes at a cost. Because if you're wearing masks when you're outdoors, even around no one, after the CDC says that's not necessary, it also could send the wrong message. It could send the wrong message, for example, that masks somehow are performative rather than a public health necessity. And it would also put our focus in the wrong way. We should focus, for example, on wearing masks indoors around unvaccinated people, not outdoors around vaccinated individuals. And so I think my point here about the address to Congress was that President Biden had an opportunity to demonstrate the power of vaccines. As in, he could have said, only vaccinated individuals are able to attend this joint session. And in that joint session, he could have said, we can even do testing to be absolutely sure. But if you're vaccinated, you get tested, you can enter, take off your mask, sit and hug, sit close to one another, and essentially we could have pre pandemic times. And I think that kind of message of projecting hope for where the country should be headed is really important too. That optimism, the roadmap forward, is just as important at times as caution is too.
And we've heard a lot from the Biden administration this week. They recently announced that we're shifting to a new phase of vaccinations, and that's getting teens vaccinated and those who are hard to reach or those who still aren't sure whether or not they want the vaccine. How do we go about doing that, though, practically?
It's going to be very challenging. Now, the Biden administration has done tremendous work to increase vaccine supply and to figure out distribution. But in a sense, that was the easy part because that was the part of build it and they will come. The people who've been vaccinated thus far are the ones who have been so eager that they'll do anything to get the vaccine. Now comes the harder part. First, we have to address individuals who actually want the vaccine, but who have so many other demands on their time. They're working full time, they're taking care of young children, elderly parents, and there are many other things going on in their lives. They can't afford to take half a day out to wait at a mass vaccination site. For them, that's a matter of making vaccination the easy and convenient choice. And so getting vaccines to all doctors' offices, to community pharmacies on a walk in basis. Ideally, also having vaccination drives at churches, bringing them to schools for the entire family, and going to workplaces. I think that will all address this first issue of people who want the vaccine, but it's a convenience issue. Then we have groups that have specific concerns. And I think we need to address each of these concerns, ideally with the most trusted messenger, people within the community, as well as individuals' own doctors, pharmacists, and nurses. And then I think there's a third group, too, who don't quite see what's in it for them to get vaccinated. And I think, in a way, those of us who've already been vaccinated and have been so eager to do so don't really understand that third group. We're saying, but vaccines save your life. Isn't that enough? Except some of these people may not think that coronavirus is that serious, or they think I'm young, I'm pretty healthy, why should I bother getting the vaccine? And I don't think it's enough for us to just say this is a societal imperative. I think we also need to be very forthright about how this is your way back to normal, as in, once you're vaccinated, you are no longer a threat to public health. So if you really want to take off the mask and stop distancing and go to indoor restaurants, once you're fully vaccinated, you can choose to do that. I actually think that if we changed our messaging to be a lot more permissive of what vaccinated people can do, I think that will really give people the incentive because otherwise people are going to wonder what's in it for me if I get vaccinated.
And you just covered very comprehensively the challenges that we're facing in terms of getting folks vaccinated and what the government can do. I know that right now, over 40% of US adults are fully vaccinated, 100 million Americans altogether. But a topic less discussed is that we waste about 21% of vaccine doses that have been distributed. And that is a high waste percentage. So I want to get an answer from you on why you think it's so high and what needs to change.
Yeah, I think this is a major problem. And actually, I think it has to do with the Biden administration's allocation formula and with lack of tracking. So, specifically, what I mean is that they have been distributing based on population, which, on the one hand, was a matter of fairness and parity early on in the pandemic. Early on, when we didn't have nearly enough supply, maybe you could say we should be distributing by allocate by population. Although even then, I had said, and I had written several columns in the Washington Post about this, about how we should be allocating based on demand and based on how quickly the doses can go out the door. Equity to me is making sure that we address the most vulnerable individuals. It's not distributing the same thing to every population across the country, including some where the supply already exceeds demand. There are many thousands of doses of vaccines sitting in freezers going unused in many parts of the country, thousands of vaccination appointments going unfilled. That is not equity to say that we need to still keep on giving these places vaccine. That's waste. That's lack of accountability and transparency. I think that we should be redistributing these doses to here in the US to places that really want the vaccine and still haven't gotten them, to places here in the US, again, that have the ability to do things like mobile vaccinations to reach hard to reach individuals, individuals experiencing homelessness, homebound individuals, to go to senior centers, schools, pop-up clinics in churches, bus shelters, and all these other places. We really need a lot more outreach efforts like that and redistributing accordingly. And of course, we also have a moral obligation and a self-interest obligation to vaccinate the world. And when there are people dying by the thousands around the world who would be alive if they were able to get access to these vaccines, I see it as a humanitarian tragedy that we're allowing our vaccines to go to waste here in the US.
And of course, as you talk about distribution or redistribution in the US, I'm mindful of the state of COVID globally, especially in India, which is truly facing a catastrophe when it comes to COVID-19, more than 350,000 new cases each day. How did India get to this point?
A combination of factors. A lot of it is that the Indian government and the Indian people, for the most part, had thought that the threat had passed them, that there were outbreaks in other parts of the world, and they thought their initial lockdowns were successful, and they were celebrating and had gone back to life as normal. But unfortunately, there wasn't enough immunity due to infection. There was not very high a percentage of the population that had been vaccinated when this wave hit, and it truly is catastrophic. We're seeing exponential surges, and the images that we're seeing, the reports that we're hearing of individuals who are dying because they don't have oxygen, because they can't even get to a hospital. We know that the actual numbers of individuals testing positive are far higher than the numbers that are actually reported, and it truly is devastating. We, as the world, have a moral and humanitarian obligation to help India. We also have a self interested reason, which is that we know that the places where variants of concern have developed are places with high rates of coronavirus spread. Look at where the initial variants came from: UK, South Africa, Brazil. These are places where, at that point in time, there were high rates of coronavirus spread. When the virus spreads and mutates, or sorry, when it spreads and replicates, it mutates. And so the surest way for us to stop variants from developing is to stop the in-person, person-to-person transmission. And the longer this festers in India and in other hotspots around the country, the more it's going to potentially impede our worldwide effort to contain COVID-19.
And briefly, in that same vein, we're in warm weather season. What do you say to Americans who are considering traveling abroad this summer? Do you think it's safe?
What I would say is all these activities that you otherwise would have been very high risk and should not do, once you're vaccinated, they are much safer. That doesn't mean that everyone is going to feel safe doing them. Some people still want to use an abundance of caution, and that's fine. But I would say if you're fully vaccinated, you should go and resume your normal pre pandemic life to the extent that you're comfortable. So please go travel. Please see your friends and relatives that you haven't for a long time before. Go to the movies, go to parks, go and have barbecues, do the things that you wanted to before, and actually tell others about your return to pre pandemic life. I actually think that that's going to be our surest way of convincing those people who are still on the fence. They really need to see that vaccines are our ticket out of this pandemic. Vaccines are our ticket back to normalcy, and you can help to model that behavior. It's at this time that we really need to project confidence in our vaccines. So please get vaccinated and then do all those things that you put off doing and enjoy our pre pandemic lives again.
And I want to end on something you said. You said that the US is in an in between place in terms of the vaccination effort. Why is this the case, and can we get out?
I believe so. We're in an in between place because there always is an in between place. Between 0% vaccinated to ideally 90% vaccinated, there is going to be that in between place. We're now at over 40% of adults are fully vaccinated. That's fantastic. We're now hopefully going to soon have 12 to 15-year-olds now be able to be vaccinated as well. But there are going to be people who either can't get the vaccine or won't get the vaccine. I have two little kids, ages 1 and 3.5. They can't get the vaccine because it's not approved for their ages. Then we have individuals who are vaccinated but are not fully protected by the vaccine because they have immunocompromised systems. And we have to remember that's why we're getting the vaccine. The rest of us are getting the vaccine to protect those who cannot get the vaccine or who cannot get the full protection of the vaccine. Unfortunately, we also have about 30% of the American public that says that they just will not get vaccinated. These are the truly vaccine hesitant. And I hope that we'll work on changing their minds over time as well. But I think that in the meantime, my two pieces of advice in this in between time one is be outdoors as much as possible. Outdoors is very protective. Even unvaccinated people can be pretty safe outdoors, even without masks, as long as they're not in crowded settings. So outdoors, great. And the second is get vaccinated. Vaccination makes all these activities that were previously much higher risk, much lower risk. And so please get vaccinated to protect all of us.
Well, Dr. Leana Wen, thank you so much for sharing your expertise with us.
Thank you very much.
And thanks to everyone for watching. This has been Know This Live. I'm Zinhle Essamuah.